There.
Okay. So what we're doing today is a knee injection, and we do that as a management for osteoarthritis. So we have our patient here, Mr. Roundtree, who is being getting those injection, and it's been working for him. We do a cycle of 5 injections on a weekly basis, every 6 months. We try to minimize the corticosteroid use to only 1 or 2 injections based on the patient response. And for the 5 injection, we do use a synthetic hyaluronic acid, which help with reducing the inflammation and increasing lubrication and flexibility within the knee. So we do the procedure ultrasound guided. So first we check the knee condition as far as major tendons, ligaments, and if there's any joint effusion or fluid collection that need to be drained prior to injection. So starting with the ultrasound procedure here, scanning across the what we call the pre-patellar bursa, which it happens that most of the knee effusion accumulate in this region. So this looks fine here. There is no fluid collection here, as it seems. We are cutting through the quadriceps tendon, which looks perfectly normal, and the other end of the femoral plateau looks good as well. And then coming down, we look at the articulation of the quadriceps with the patella, which looks fine. And then scanning down to the patella, it looks intact. And then down here, we continue on looking at the patellar ligament, which looks perfectly normal. And all the way down to the tibial attachment or insertion, which looks normal as well. And over at the lateral aspect here, we peek at the lateral meniscus, which looks fine, and the collateral ligament. And on the medial aspect, there is the medial meniscus, which also looks normal. Very well. I also take images in an extended position of the knee. Sir, can you just put your heel all the way down? Good. Excellent. Good. And with your leg relaxed. Okay. And then we're gonna just rotate your knee a little bit this way. So the value of that is opening the pre-patellar bursa and seeing if there's any fluid collection. Obviously here we see some effusion, which was not very evident on the previous view. So there's a little bit of fluid accumulation here. So yeah, we're gonna just adjust the knee here a little bit. Okay. Good. And then we're just gonna have your muscle here completely relaxed. Okay. Very good. This is about a moderate size effusion. It's not a whole lot of liquid. So very good. So we're gonna use what we call a suprapatellar approach and try to drain the fluid. Sometimes a little bit of pressure on the contralateral side can help with the fluid drainage. But I think this is about the size of the effusion. That was about 10 cc, which appear to be more or less of that on the ultrasound. So now we're going to proceed with the first injection, which is the mix of the corticosteroid plus the topical anesthetic. The injection should be going like very easy. There should be no resistance. If you are in the knee cavity, if there is any resistance with the injection, really the needle should be repositioned, or the side of the approach to the knee should be completely changed. Otherwise, because you might be injected into a tendon or ligament that you shouldn't be doing. And then this is the gel injection, so that goes next. It goes a little bit slowly because it's a thicker fluid, but again, should be with minimal resistance in a way. Very good. And that part is done. So we do check post-procedure images to see the condition of the effusion, and sometimes we're able to spot where exactly the injection site went to. So as you can see here, there is much less effusion comparing the black, and then there is movement there with the gel that we just put in the knee bursa. The original effusion actually is completely gone now. This is some of the gel and the corticosteroid injection. So it looks very good. Excellent. Very well. And that concludes the knee injection.